researchers were interested in knowing, was there a difference between people treated and not treated if they tested this specific way of using visual acuity. They also measured how fast someone could read, how well someone could see colors, and then they also polled all the patients. They did a poll and they said, hey, is your quality of life better in some way after you've been treated? In the first study, the anatomic things that they did was scan the retina and take special black and white photos, similar to what we saw earlier, to see if geographic atrophy develops or if it doesn't develop. And then in the second half of the study, the 24-month study, they measured how often did geographic atrophy happen, and was it complete geographic atrophy or was it incomplete geographic atrophy? This all sounds nice, but I need to make something very, very clear. This is hard to understand, but I'll try my best. When you are a scientist and you have a particular question in mind, you need to know if you can answer that question or can you not answer that question. I'll give you a very straightforward example. If you make a peanut butter and jelly sandwich and you have two people who are your study subjects and you want to know which peanut butter and jelly sandwich tastes best, and you have two people to poll, you give both of them two sandwiches, and both people say this thing is the best thing ever, is it really true that if we gave that peanut butter sandwich, the one that both people agreed is the best, to all the people in the United States, all 350 million people, that we would predict that that difference between the two peanut butter sandwiches that I made would be valid? Or is it possible that I didn't have enough people to make that assertion? Well, that's a problem. So in this particular study, for example, they have 100 people and they tested more eyes than people because some people were treated in both eyes. We want to know, was that enough people to know that the differences that we find in the study is actually valid? Akin to what I did with my peanut butter sandwich. It's possible that if I make two nice sandwiches and I ask two people or five people and I hear overwhelming applause, good job, that one sandwich you made was great, that other one was not very good, it's possible if I apply that concept to millions of other people that I might actually find that what I had was not actually valid. Rather, people in a larger population would have liked the other sandwich, not the first one that my 5 or 2 people said they liked. We call that powering. Powering. That is the difference I'm about to encounter